For most people, being a first responder is a secondary role that's a part of their regular full-time job. Some first responders are firefighters, law enforcement officials, corrections personnel, or security workers. Others might be industrial employees, lifeguards, public utility employees, or school teachers.
Regardless of your occupation, as a first responder, you are the first link in the emergency medical services chain that also includes emergency medical technicians and paramedics. Like these others, you are trained to provide help in the crucial period of time before the patient can be taken to a hospital for comprehensive care. The difference is, you will often arrive before EMTs and paramedics and will need to act quickly to prevent a patient's condition from getting worse. As you view this first responder skills tape, you will be shown how to approach an accident scene, how to assess and examine a patient, and how to provide emergency treatment. The skills presented here may vary from one community to another. Check with your medical director or local EMS authority to determine how to best treat patients in your area.
The skills you will learn in this course are important because they are the foundation of the entire emergency medical services system. Your actions can prevent a minor incident from becoming serious. They may even determine whether a patient lives or dies. And who knows, the next medical emergency you face might be that of a friend or family member. The knowledge you're gaining now will help you cope with unpredictable situations wherever and whenever they happen. One of the primary goals of first responder training is to teach you how to evaluate, stabilize, and treat patients using a minimum of specialized equipment. And for good reason. First responders often find themselves in situations where little or no emergency medical equipment is readily available. With this in mind, here are 4 basic principles of first responder training that should guide you in every incident.
First, you should know what not to do. This simply means understanding how to avoid further injury as you help your patient.
Second, know how to use your first responder life support kit. Check your textbook for the suggested contents of the kit.
Third, know how to improvise. No 2 emergency situations are exactly alike. The ability to think quickly and make the best use of any available resources will determine your success as a first responder.
Fourth, know how to assist other EMS providers. The biggest contribution you'll make will be in the initial care you give to the patient before other EMS providers arrive.
But you'll also need to be ready to pass on information you gather during your evaluation and treatment. Additionally, you can help with common procedures used by EMTs and paramedics, which cannot be performed correctly by fewer than 3 people. The emergency medical services system that you're a part of has been shown to dramatically increase survival rates for patients who have a major accident or sudden life-threatening illness. For most people, reaching the EMS system means dialing 911.
At this point, critical information is needed, including the patient's location, your name and phone number, what happened, the condition of the patient, how many people need help, and any special conditions or circumstances.
Of course, there's more to the EMS system than 911. The other components of the system are important to understand too. See your textbook for a complete outline.